Maria, I think, so, I'm hoping you think, do we have our next back on in here?
Shouldn't recommend
Do we have to please?
it. They know they. Okay, fine, fine. No, we won't say anything about it.
We're not doing this.
Okay,
Just don't leave that door.
okay, all
You're
right.
not going in the community without a mask.
Oh, well, so when you go out
You
there.
can go there, here.
Okay, all right. What did you say?
Oh, okay. As long as everyone is drinking something, we can keep our masks on. But I don't have them in those sides.
Okay, but I think
Next time.
the community would like us
Oh,
to keep
yes.
the community safe, so when
Yes.
you go out, the bathroom is down the hall. If
Make sure
need
you wear your
that.
mask.
Make sure you wear your mask inside the community. Here and outside, you're okay.
If you're comfortable
If you're
without your
comfortable,
mask.
otherwise feel free to put it on. Yeah. Okay, well,
For being on PC.
let's go ahead and get started. First of all, I want to introduce the Belmont Village team. So first of all, thank you so much.
Oh my God,
Natalie
that's
and
so
Maria.
awesome. Stepping up.
For those of you who got here, congratulations, because we changed the location literally 2 weeks ago. Last minute switch, these guys came in a pinch, and we really appreciate it. Now, for those of you guys who were thinking you were going into Santana Row, accidentally stop here, you're stuck, you can't leave until the talk is over, but thank you so much. So usually what we want to do is thank them, but also allow them to give like, a little elevator pitch about this community. So this is your chance. Oh,
Well, again, thank you, Wesley and the Senior Roundtable for choosing us to host this morning group. But my name is Natalie. I'm the Executive Director here, and I've been at the community for about 2.5 years. And I really just want to say thank you. We're really excited to see so many familiar faces and some new faces. We have people back in the community. I know the last year or 6 months or so has kind of been a homecoming of sorts for a lot of us. We get to see each other again and be together. So we're really excited to continue doing this and continue to make connections with all of you. But yeah, again, welcome. Thank you for being here, and turn it back to Maria, or over to Maria.
Hi, everyone. So I'm Maria Castro. I see a lot of familiar faces and some new faces. So welcome to Belmont Village. I'm in community relations here. Started at San Jose Santana Row last year in February. I moved from Washington State. Been in the industry for a really long time and really grateful that I was able to join straight away an organization that I believe in. So Belmont Village San Jose has been here for 20 years. And if you don't know yet, we went through really intense and amazing remodel. So the inside of our building is not 20 years old, that's for sure. We added a new movie theater, new art studios, just a lot of amenities for our residents that we found over the 20 years has come to be very beneficial and therapeutic. So slowly but surely, as our residents transition out of apartments, we've even been remodeling the interior of the apartments. So I see some faces that have been in the industry in this area for a long time. If it's been a while since you visited and toured our community, we would love you to give us a call so we can show you around and see what we've been up to. We have assisted living, our Circle of Friends program, which is memory care in assisted living, a very unique program. And then we do have memory care as well. So if you have any clients that you're working with, anyone who's looking around for options, we would so appreciate us getting connected with them and seeing if we would be a good fit for them. So thank you for being here today and allowing us to host Wesley and team.
thank you so much. So we did a survey last month. I don't know how many of you participated. We had like 40 people, which is great. Okay, and so it's more than just a few of us. And one of the things that kind of came up was mental health. And today we've got Dr. Ann Bilbrey, who will be talking about that. Isn't that amazing? What a coincidence. And a lot of you last month also said you wanted to hear from Tammy Anastasia and the work she does with dementia, and we're gonna have her next month. Are we good or are we not good, Sean? No, okay, it's just amazing coincidence, but we're taking all that information to line up speakers and other programs for next year. So really excited about that. Okay, let's get started. So, I want to tell a story first because, I'm a storyteller about geriatric depression. So when I was visiting a client to do an installation, this is for, my stat care system. Usually I have an installer who goes in, does the work, and I hang around, as Molly knows. No, don't worry, he's not your client, Molly. We'll tell that story another time. And I'm usually the guy that goes talks to the residents, and usually it's an old lady, and I usually know how to charm the socks off the old ladies. Well, this lady wouldn't talk to me, wouldn't see me, wouldn't do anything. I'm like, turned up the charm to 11 and nothing happened, not a peep. And I realized it wasn't me personally, maybe it was, but she was severely depressed. And we heard after about a week, she actually moved out because even the community couldn't handle her. Literally, she was like on hunger strike, wouldn't do anything at all, okay? Now, some of you probably have some of those clients, okay? But I want to talk about that because Dr. Bilbrey is going to give us the magic answer to solve all those problems. Am I setting up the right expectations?
Sure.
I like to embarrass all our speakers. Okay, so Anne is the CEO of Optimal Aging Center. She received a PhD in clinical psychology from Palo Alto University, yay, and completed her postdoctoral training at Stanford University's Alzheimer's Disease Research Center. I know many of us work with people of Alzheimer's, so you definitely want to talk to her. Along with Dr. Dolores Gallagher Thompson, she is the co-developer of the Coping with Caregiving Suite 2.0 workshop series. She is the author of numerous papers and book chapters on caregiving, CBT, and behavioral activation. Now, you didn't actually explain what CBT is, so there will be a quiz later because she'll be talking about what CBT is. Very important. Along with her co-authors, her most recent publication is in the Treatments That Work series, titled Treating Later Life Depression, a Cognitive Behavioral Approach Workbook. And over to you. Let's give her a hand.
So I'm going to ask everyone to be patient with me because this is the first in-person talk I've given since the pandemic. So, it's quite intimidating because I can't wear my shorts. So I have notes because I have a lot of information to share with y'all before, and I only have an hour to do it. So I'm going to try and keep on track. If you could save questions to the end, hopefully I'll have time, if not formally, at least informally, because I'll hang around till everybody's done. So I'm going to say, first off, thank you all for inviting me to come talk to you. Treating later life depression is vitally important because there's a myth out there that says depression is a normal part of aging. And it isn't. It is treatable. We can totally improve quality of life. We can help older adults to really enjoy their last years without necessarily having to deal with depression. So today we're going to be talking, next screen. So today we're going to be talking about some of the specifics about depression in older adults. You guys may know some of these facts already, but I'm just going to give us some brief facts so we can all be on the same page going forward. And then I'm going to introduce to y'all a tool that you can use. You don't have to be a mental health professional to be able to use this. It is usable by spouses. It's usable by professionals who work with older adults. You don't have to have a degree to be able to make it effective. It's called Positive Activities and is part of behavioral activation. Finally, I'm going to share with you what to look for to know when it's time to hand off to a mental health professional. So if you guys don't have the training and you're feeling uncomfortable, you're going to probably be aware of the signs before you actually mentally note them, if that makes sense. So let's go ahead to the next slide. So let's jump in with older adults and depression. Next slide. So I'm going to start with prevalence. I'm really sure that most of y'all are aware that depression is not a normal part of aging. In fact, what we have found in research that as someone gets older, their reported well-being actually increases. Somewhere between 8 and 16% of older adults experience some symptoms of depression. About 5 to 7% are actually diagnosable with major depressive disorder. Some studies have shown that when we go into nursing homes, we can see up to 50% of the population there with some symptoms of depression, if not an actual diagnosable case. It's important to note when we start talking about depression that men older than 75 have the highest annual incidence of suicide. And we're going to go into that a little bit more towards the end of the talk. But what are we talking about when we say that? The actual numbers is something around 39 deaths per 100,000 men compared to 4 deaths per 100,000 women.
Wow.
So there is a distinct difference. We're going to talk more about this in a moment. Go ahead and thank you. Some of the risk factors that we look for when we're talking about depression, right? And when we talk about risk factors, we're not necessarily talking about a cause. These are just some of the things that you can be aware of when you're talking with clients. If they have a couple of these, you might really want to check in with them on what their mood is like. So one risk factor is being female. Having a chronic medical illness, having a disability, sleeping poorly, being lonely or socially isolated, right? Because a lot of times people may be socially isolated and not talk about being lonely, and yet they may be. Have personal or family history of depression. Using certain medications, some of the side effects look a lot like depression or may set someone up to be depressed. Have cognitive impairment, right? And then misuse of alcohol or drugs, including prescription medications. And then having experience or experiencing a stressful life event. So what am I talking about? Things like loss of a spouse, they might be going through a divorce, those kinds of things. And then also we can't forget our caregivers, right? And these are folks that are taking care of someone with a chronic mental or physical illness. Now, obviously not every female is depressed, nor is everyone who goes through a stressful life event destined to be depressed. But it's important to know that if your client has a few of these, that you check in. That's why I go over it. So, you jumped ahead, great. What's the difference? You know, it almost seems like when we talk about depression and depressive symptoms, we're talking about something that's in, one for another. But I really want to let you guys know that depressive symptoms are things like feeling sad, being irritable, at times maybe expressing feelings of hopelessness. It's a loss of interest or pleasure in the activities that they used to enjoy. Things like appetite changes. So some people eat a lot more when they're feeling down, other people will eat a lot less. So you're looking at those extreme changes in appetite. Things like sleep change. Again, too much sleep, someone who's sleeping all the time, or somebody who is having difficulties falling asleep, staying asleep, waking up way too early in the morning. Restlessness, or perhaps feeling slowed down. A lot of times people will describe it like, I'm sitting still and the rest of the world is just passing me by. Things like a loss of energy. Right? That's a big one. A lot of people complain or report things about just feeling fatigued. They just want to do anything. They have no energy to do things. Feelings of worthlessness. Slow thinking or loss of concentration. Things like, I pick up a book I used to love to read, I just can't finish a page. Or I want to watch a show, but I can't, I can't pay attention to it enough. And at its worst, we're talking about thoughts of suicide. When is it a problem? So depressive symptoms equals some negative feelings, right? They may have one or two of these, 3 maybe. But when it becomes 5 or more of these symptoms that they feel every day for most of the day for 2 weeks, then it's something that they, it's a clinical diagnosis. At that point, you need to send them off to a mental health professional, especially if it affects their daily function. Having depressive symptoms versus being depressed are very different. If your client is clinically depressed, they're going to need more than the tool that I'm going to give you today. It can be part of a treatment, but it isn't the whole treatment. And of course, if ever your client talks about harming themselves or harming someone else, we also highly recommend that you refer them to a mental health specialist. So go ahead, next. One thing I want to mention, depression is totally treatable with medication, with psychotherapy, or with a combination of both. So no one needs to suffer needlessly. There are some challenges to identifying depression that you should be aware of. We talked a little bit earlier. Men and women present differently. Right? In men, you tend to, they talk about being irritable or angry all the time. We hear a lot about they just don't get pleasure from doing anything anymore, right? For women, we hear a lot more about the physical complaints or a general dissatisfaction with life. There are signs and symptoms of depression that can look different depending on the person and their cultural background. People from different cultures express emotions, moods, and mood disorders, including depression, in many different ways. In many cultures, depression can be displayed as physical symptoms, things like aches and pains or headaches, cramps, digestive problems. You hear a lot about somatic complaints or this physical complaints, right? And really one of the things that makes depression challenging, especially with older adults, is this a physical issue or is it a mental issue, right? Some of the things that we talk, these changes in appetite, right? Lack of energy, sleep disturbances, feeling slowed down, general aches and pains. How many of us could take a look at half a dozen different diagnoses in a medical book and say, yeah, these are all the same symptoms, right? So it's just something to be aware of that can make it challenging to identify depression from something else. Another challenge, many older adults come from a time when they just didn't talk about psychological problems. Their grandchildren may feel comfortable flying their flag, telling everybody about how they're depressed, but grandma and grandpa, not so much. The psychological complaints, these are things like feeling sad, loss of interest, that inability to concentrate, and associated anxiety. Because if you're older and you're not concentrating well anymore, what's the first thought that comes to your mind? Oh my God, I must have dementia. What am I going to do? Who's going to take care of me? All of these things, right? So it's important to be aware of that. Another challenge, there are over 200 medications right now whose adverse effects look like depression, right? These some of these medications, blood pressure medications, antacids, painkillers. So that can also be an additional challenge. Can be incredibly difficult to make that differential diagnosis between early cognitive impairment and depression. And then finally, and perhaps the most difficult to overcome, is the rationalization by family and the client themselves. Well, this is just normal part of aging, right? This is what all old people do, right? We pull in, we isolate, we don't reach out to anybody anymore. So it's important to note that it's not your all jobs to identify depression, but these can make it a little bit more difficult to tease out those depressive symptoms. Next slide. So we're going to jump into the tool that I'm going to share with you today called positive activities. Go ahead. So positive activities, sometimes you'll hear them called behavioral activation. These strategies have been found incredibly effective at reducing symptoms of depression, as well as increasing the frequency of healthy activity levels. So, and this has been, it's evidence-based for older adults. There aren't a lot of programs out there or interventions that are evidence-based for depression with older adults, this and CBT are part of them. Many times these positive activities are activities that they used to enjoy. And for some reason, many different reasons, they're not doing these activities anymore. A lot of time, these activities are related not only to things they find pleasure from, but also things they find meaning in, or things that align with their values. Perhaps the most important reason that I'd like to get out into the community and share this tool is because behavioral activation or positive activities, they engender hope, right? And they lead to a fairly rapid reduction in the depressive symptoms. Go ahead. Let's talk a little bit about why it works. So it's based in a theory that as individuals become depressed, they tend to engage in increasing avoidance and isolation, which serves to maintain or worsen their symptoms. So if you look up on the screen, right, we have a downward spiral on the far right, my right, your left.
Yeah.
So think about this. So the first time maybe a girlfriend asks them out for lunch, they're like, I don't really feel like getting dressed. I'm going to say no. They feel a little bit worse, right? The next time somebody asks them to engage in an event, maybe it's a Zoom call with their grandkids, maybe it's, going for a walk somewhere, they're feeling even worse, so they're like, no, that's okay. That's that avoidance and isolation. The more they avoid, the more they isolate, the worse it gets. That's a downward spiral. The reversing that tailspin or reversing that downward spiral is they go step by step by getting them out into the community, by getting them engaged in events that they used to find pleasure from. Even if they don't find it in the moment, then you start to make them feel a little bit better. They go out, they do something, they're like, oh yeah, that's right, I really enjoyed going out to lunch. I should do that more often. The idea is they feed the thing that makes them feel better. The goal is to work with the depressed or the person experiencing the depressive symptoms to gradually decrease the avoidance and isolation and increase their engagement in activities that have been shown to improve mood. So why does the positive activities work? Well, we know that events and activities control mood. If you all think of the last time you did something that was really enjoyable, right? Even if you think back on it now, you smile because it makes you feel better. It makes you feel better while you're doing it. It makes you feel better after when you think about it. To some extent, everybody has some control about whether they engage in these activities or not. Therefore, once they make that connection, they realize that they can control their own mood by either adding or taking away the activities. By increasing this sense of control, they increase their sense of efficacy. So their mastery of being able to handle this. So they're able to own the fact that they can reduce their own depression and improve their quality of life simply by adding these pleasant activities. So you might get some pushback that something so simple would really work. Every time I introduce this to a group of caregivers that I work with, they're always like, surely. We'll just smile and nod and then walk away like y'all crazy. I will tell you now, your presentation of it, your belief in that it will work, will communicate and help to convince them to at least try. One of the most common depressive symptoms is that lack of interest in doing things, right? If you think about the last time you were feeling a little down, right? I bet most of it was accompanied by the, I just don't feel like getting up off the couch, right? That is an active pushback against this intervention. If it comes up, you have to acknowledge it, right? You may hear things from your clients like, you have no energy, or honey, that sounds really nice, but I just can't think of anything to do. These both are like identifying phrases that you can listen for to know that they're experiencing that lack of energy or lack of interest. For these people, You have to convince them just do it. Pull out the old Nike mantra and just really work that with them. That means they got to plan it, they got to schedule it, and then they got to do it, whether they feel like it or not. Basic goal planning is very helpful here. If you're not familiar with the SMART goals, I recommend you look it up on Google. There's tons of information out there that can really help you step somebody through how to get something planned so they're actually going to execute. Give you a quick example, and I know many of you can relate to this. I have to exercise, right? How many of us are like, oh my God, I just got home from work, I don't feel like doing it. And we're not even experiencing depression, right? So you know that there's a pushback there. So you can problem solve these barriers ahead of time. So what am I talking about? How about taking your sneakers and putting them by the front door? So every time you walk by them, you're like, oh, right? How about calling up a girlfriend and making an arrangement that you go for a walk together? Because a lot of us, especially women, will do for somebody else before we will do for ourselves. So if our girlfriend comes and knocks on the door and says, okay, let's go, you're gonna be like, go out the door, right? So these are kinds of barriers that your clients can run into that you can work with them. Drawing on your own experience, drawing from them some ideas on what may work. The important thing that a lot of this is trial and error. So go ahead. How do you introduce positive activities, right? That's always a big question. Positive activities themselves are things that give you a sense of pleasure, meaning, or purpose, right? They can be big or small. An example of a big one is maybe going out to see a play with some friends, right? Small thing can be that first sip of coffee in the morning when the house is quiet and you got just yourself and you're like, oh, that is so good. That is a pleasurable activity as well, or a positive activity as well. Scheduling is really important in this, right? So there's some planning involved. If the object here is to take back some control of your day, you can't just pick stuff out of the day that just happened and said, hey, look, I did it, right? So you need to plan for it, even if it's something you already do. Let's say you get out and you exercise 3 times a week because you're awesome. If you do that and you get some sense of purpose from it, right, or it has some meaning to you, or you get pleasure from the actual, after, during, right, it's after, then that is something you can plan for and you do. There is a conscious and deliberate intent behind positive activities. Positive activities can be done alone or they can be done together, right? They don't have to have somebody else to be successful, although for some people, having somebody to do things with is part of the thing that makes it positive. But there are issues when you bring somebody else in, right? Are you going to still do the activity if they don't show up? What if they're not as excited about it as you are? Are you going to get the same amount of, enjoyment from it? What if your choice is to go out and volunteer somewhere because you get some meaning from it, but your rideshare guy doesn't show up? So involving others in your planning, especially in the beginning, can make it incredibly difficult to get it up off the ground. Not impossible, but it can make it harder. And if you are talking to someone who's experiencing some depressive symptoms, it might be easier to keep it simple and easy to do. That sip of coffee, where the only responsibility is to make the coffee and that's yours, it's much more likely to happen than if you're going to go out to lunch with somebody and sometimes they show and sometimes they don't. Who's going to pick you up and, where are you going to go and will they want to eat? And, as you can see, it becomes much more complicated. Start small and simple. Positive activities can be brief, lasting only a few minutes, or they can take all day. It's not the activity so much as it's that you do it. So I'll leave that for a second and sit there because this is really very important. If you schedule the activity and you don't do it, you're not going to get the push or the boost in your mood. It's about scheduling it and about doing it. Next slide. After you introduce the positive activities, the next step is going to be making a list. And you can guide your client in making the list with the following questions. Things like, how are you currently spending your time? What did you enjoy doing in the past? Can you do it now? Can it be modified to work now? Right? If you have someone who really enjoys hiking out into the back of beyond and taking these amazing wildlife pictures, but now they're taking care of their dad and they can't leave their dad for an all-day hike, what aspect of that did they really enjoy? Can they find a way to replicate it? You know, can they put a bird feeder in the backyard? And maybe they can concentrate the next few years on catching that perfect flight of a bird, right? As they just start off from the feeder. The idea is that you can modify most activities to meet the need as long as you understand what that spark was, what elevated the mood from that activity. Sometimes that takes a little bit of digging. You want to encourage them to make a list of 10 to 15 items in this first. Next slide. Stress staying active, right? Physical activity is incredibly important. You know, Wesley was teasing me about that magic pill that makes everything fabulous.
Yeah.
I'm sorry to say it's physical activity. I'm the first one to admit, but it is. You know, there's a ton of research out there that shows the benefits. In mental health, staying active, physically active, can be as effective as using an antidepressant. It showed people who routinely stay active report an improved sense of well-being. They actually have some fabulous research that came out within the last 10 years that show that people that stay active, that do aerobic exercise in moderate intensity, they can maintain their cognitive function, including those that have been recently diagnosed with cognitive impairment, right? It helps to improve sleep. How many of your clients come to you and say, my sleep is horrible? And I know you're going to look at them and say, join a Zumba class. Physical health-wise, we've got tons of reports that show that routine, consistent use of moderate intensity aerobic activity can manage or prevent things like arthritis, heart disease, stroke, type 2 diabetes, osteoporosis, and 8 different types of cancer, including breast and colon cancer. Remember I said magic pill? Yeah. Why is it always the one that we never want to do? So what is the goal? No, you don't have to run a marathon. This is 150 minutes or 2.5 hours a week of moderate intensity aerobic exercise. Now, what do I mean? Obviously, aerobic exercise is that exercise that gets your blood moving. Moderate intensity, there's a lot of really complicated ways of measuring it. You can get one of these very expensive little watches. You can do 100 different things. Easiest way, best rule of thumb that I have found, if you can sing while you're exercising, you are not exercising at a moderate intensity. So the idea is you can talk to your friend, but you can't sing.
Oh.
So if you're breaking out into some of the Oklahoma songs, gotta go a little faster. If they're new to exercise, they've been sedentary for a long time, you obviously are not going to encourage them to hop out and run that marathon and start jogging. What you are going to encourage them to do is go talk to the doctor, make sure that they are cleared for exercise. Just because they have a disability does not mean they cannot exercise. There are modifications that doctors can recommend to make physical activity doable for them. So they need to check in with their doctor, their physical therapist, somebody in the medical field that knows their conditions. There's also a URL. Is it on the bottom here?
Yeah.
Good. This URL right here, fabulous webpage by the NIA that literally talks an older adult through the process of adding physical activity to their daily life. It's great for those of us who are just reaching that age, that older adult right? I mean, those of us who maybe have been sedentary for a while and finally read all the research and finally into the magic pill, that has been a fabulous way of learning how to exercise so you don't hurt yourself. So I highly recommend that as a start. So go next. So now we're going to add to the list, and you're going to encourage them to add at least five staying kind of active activities. You notice I flop back and forth between staying active and physical exercise. That's because exercise in our society has become a dirty word, except for those that have fully embraced it. Especially for older adults who will look at you like, oh, I am so pissed. Right? I have arthritis. I can't even bend down to tie my shoes. Now you want me to go out and exercise? Are you crazy? So you can say staying active. It doesn't have quite the same stigma. You have to know your client and know what they're willing to hear. But you want to add at least 5 different things, exercises that they like to do. And this can be yoga. It can be Zumba class. If you've never watch a Zumba class on YouTube. Because doesn't matter if you never get up off, you're just going to be laughing hysterically by the time you're done. So those are the types of activities that you really want to encourage them to engage in. Because if you can get somebody to laugh, you've already done half of your work right there. So that said, if you run into someone who's really struggling and they cannot think of a thing to do, and there are a lot of older adults, there is something called the COPUS, which is the California Older Adults, Older People's Positive Events Schedule. Long name, we all just call it the COPUS. What it is a huge list of activities, and it takes someone through, this is something I used to enjoy to do. This is something, hey, it looks kind of intriguing. Maybe I'd like to try it. And then once they do that, they're like, well, how much do you think you would get pleasure from that? And you have to rank it. This gives them ideas to work from, things to try. There is a web version, which means you can sit in the office and you can set up on the computer and they can do it. You just got to print the report when it comes off because we don't keep it. Once they close out of the window, it's gone forever. They have to retake it to be able to get the report again. Or you can download the paper version and you can sit with them in the office. This is honestly the best way. Go through with them, and if they're kind of overwhelmed because it's a lot of pages of just activities, you can say, well, have you ever thought of this? And just work with them one-on-one. But it's a great way of sparking ideas. So by the time you get to this point, you have 15 to 20 different activities. Go ahead to the next. And that will lead us to the positive activities line, or PAL, as we call it. If y'all have ever worked with psychologists, you know we love our forms. And there's a reason for it. There is a mental intent when you write something down, especially before computers happen, which most of the older adults are going to be working with, right? The only way to communicate something in a written form was to write it down. So when you write something down, it engages different parts of your brain. If you're struggling with a concentration, you only have to pay attention to one thing at a time. You don't have to hold it all in your head, right? So this is one of the few forms I heavily encourage people to download and use. At the end of the talk, I'm going to share with you a Google Drive folder that has all of this stuff, a PDF of the PowerPoint as well as the form that you can download and use. As you can see, it's a pretty simple form. It has a place to list 10 activities that they're going to pull from that list that they made of like 20, hopefully you have 20 items on there. Day 1 through day 7, so it covers a week. What they're going to do is they're going to look at this list and they're going to pick 4 activities a day that they're going to try. And to schedule it, all they're going to do is put a slash down, right? When they complete it in their day, they're going to add the other side to make it an X. So they know which ones they did, or which ones they did and which ones they didn't do. So that next week, they can then revise their list until at the end of, say, 6 weeks, you have 10 activities that they know will elevate their mood. At the end of each day, they're going to note how many activities they did, and they're going to give themselves a 1 to 10 on their mood score. The hope is is that down the line, 6 weeks from now, after they look at 6 pages of the 6 weeks, they're gonna be able to note, hey, the days I actually did 4 activities, I had a much better mood.
Mm.
Right? You may not notice it in the day you're doing it, but if you see evidence week after week after week, you start to make that connection that the activities that I do actually improve my mood. Next one. So for effective use of the skill, scheduling is an important part of the process. They should not look back over their day and go, hey, I did this and this and this, right? It has to be scheduled. It's important to actually talk about that lack of interest, right? A lot of times, if you don't physically bring it up, they will feel it's a failure on their part. They will attribute things like, oh, I'm just lazy, right? Especially if they're not really in touch with their mood. We make it, we are so much more meaner to ourselves than we would ever be to somebody else, right? And if they have a history of that, and they haven't gone through therapy so they recognize it, they'll probably continue to do that straight through. It's really important not to wait till you feel like it or till you're motivated. It's important that if you've scheduled the activity, you just do it. You trust in the process that it's going to make you feel better. You may not feel it in the moment, but get them to commit to 6 weeks of this. By the end of the 6 weeks, they will most likely feel a lot better. Research has shown that the best dose for the positive activities is 4 positive activities a day. Now, please know, I'm not talking about planning 4 all-day activities. What I'm talking about is these small, discrete moments that they do consciously and deliberately in the day to make themselves feel better. Right? So that first sip of coffee is a great one. Spending a minute or 2 out in the garden listening to the birds, right? Feeling the sun. When's the last time you all sat in the sunbeam for a few minutes? There's a reason why cats do it. Just saying. Finding these small activities are what's really important here. It is really important that you discuss the barriers before they happen. Simple question is, so I noticed last week that you didn't do this activity. So what stopped you? What made it so it didn't happen? A lot of times it'll be like, well, I just didn't have time in my day. So how can we make time? What are some of the things that we can do to make sure that you remember to do the activity? What are some of the things we can do to find time in your day to make this happen? Right? So these are all things that seem really easy to think about while you're sitting in your office, but when you actually run into a client, it's important to remind yourself that you have to talk about the barriers, because otherwise they just take it all in themselves and they just say, no, it's all my fault. Next slide. Figuring out the dose. Researchers show an average 4 activities a day, but your client may be different. Your client may need 5 or 6. Your client may be good with 1 really good. Talking to the grandkids, man, that thing can make them feel good for a week. It's important to identify those super responder activities. Maybe put a little star by them, maybe put a highlighter on them. But it's also important to find those activities that just, make you feel better. Excuse me. You really want to encourage over time that connection. Right? Hey, I was looking through your pals, and I noticed that on those days you did 4 or more activities. You're reporting a better mood. Did you notice that? Right? So making that connection, if they don't bring it up to you first, pointing out that connection between doing activities and making you feel better, that is great. For those that are struggling, they're just down all the time, you got like 1s. Either refer them out or have them identify what, you can put a little note next to the activity, right? Hey, when I did this activity, I felt like a 3, maybe a 4. So that can help to identify which activities. Next list, or next. So revising the list. This is a multi-week process. right? You're kind of committed to work with a client on this process over a couple weeks. Most people find that 6 weeks is what does it for them, right? Within the 6 weeks, they can identify at least 10 good activities that they know. This is a life skill, right? This isn't a one-time. If working with you and putting the work in now can help them to identify 10 good activities, those 10 good activities are good whenever they start to feel down, whenever they notice themselves being irritable, whenever they notice themselves like withdrawing. They can pull out that list and then they can go, oh, that's right, I can do this. The goal, again, is to find 10 solid activities they can use to make themselves feel better at any time. Next. Summary of the steps. So you'll have, this slide that you'll be able to use as a reminder. You're going to identify specific activities or situations associated with positive mood, which can be added to their day. They're going to schedule, do, and track these positive activities every day and notice if there really is an association between their mood and the activities. And then they're going to revise or modify this list based on their changing needs and observations about what works and doesn't work. Next slide. I'm going to talk a little bit about when to refer. So these are your crisis situations. Go ahead, next one. If you feel that their depression maybe isn't just depressive symptoms, maybe it's creeping into, wow, you seem to have a lot of these issues, you may want to refer them out to a mental health professional or specialist. Or you can refer them out to their PCP, right? Their primary care physician. Both of these, at least you're getting them into care. Again, as a reminder, this is 5 or more symptoms every day, most of the day for 2 weeks. And it impairs their function. It's good to have a list, or at least know where to send people to find lists of their of who's accepting clients at this point. A good one is always send them to their insurance, because they're going to want to know if they can get paid. Go ahead. Next one is if they're non-responsive. If you work with them for 6 weeks, they don't seem to be getting better. They may be a resistant case, or they may need something else, or they may need something else in addition. You're going to want to refer them. Next one. Suicidal thoughts. The one topic everybody hates to talk about because you're afraid if you start talking about depression, all of a sudden you're going to have a crisis on your hand. It's an important thing to note that suicide attempts by older adults are much more likely to result in death than among younger persons. And this is for a couple reasons. Number one, they tend to plan more carefully and they tend to use more deadly methods. Older adults are less likely to be discovered and rescued because they tend to isolate. And then, of course, most older adults are physically frail. So it makes recovery from an attempt a little bit harder. Go ahead with the next one. It's important to note that people who talk about suicide are not trying to get attention. This is a myth that is out there, and it just seems to be incredibly persistent. No matter how many times we tell you it's not, they're not just trying to make you pay attention to them. There's a lot of research out there that shows that people who die by suicide, most of them have attempted to let somebody know that something is wrong. Right? A lot of times what we'll see is they visited the doctor less than a month ago, or they talked to family members, or they talked to a friend. People who are considering suicide tend to give clues and warnings as a cry for help. You may hear things like, everyone would be better off if I wasn't here, right? Or, next week maybe I just won't be around. So you may hear things like that. They start to give away precious things, right? They want to make sure that their pets are taken care of, those kinds of things. You want to check and see if they have access to lethal means. What does that mean? Do they have firearms in their house? That's a big one. Right? When I said that people who are older, they tend to use more lethal means, mostly they tend to use guns. So you want to check if they've been hoarding their prescription medications. That's another one thing you want to check for if they've gotten recent diagnosis of a medical condition that is going to heavily impact their life going forward. Right? We see that sometimes people, especially men, who have been recently diagnosed with cognitive impairment or dementia, Alzheimer's, those kinds of things, where the prognosis is pretty poor. There are some protective factors, things like receiving care for mental or physical health problems. If they're socially connected, that's a huge protective factor. If they have a sense of meaning or purpose in their life, if they have skills already in coping and adapting to change, and then finally, if there's cultural or religious beliefs that discourage suicide. Those things all are protective factors. Next one. There are certain crisis lines out there that can be incredibly helpful. I always encourage people before they give a crisis line out to somebody that they have called it personally. Even if you are not in crisis, giving them a call, figuring out what are the steps somebody has to go through can be incredibly helpful. So when you sit down and you say, well, have you ever thought of calling the friendship line? That you've already done it and you know what they offer so you can talk about it in a knowledgeable way. Suicide, the National Suicide Prevention Line has now, you can still use the big number, the regular phone number, but you can also call 988. If you have a veteran, they can use option 1 and they get immediately routed to somebody who's already aware of specific issues that veterans can run into. PTSD, they know the VA and how to access it. A lot of them are veterans already themselves. They've been through what they've been through so that can help them. The URL is up there as well. The Friendship Line, the Institute on Aging up in San Francisco, has the only accredited crisis line for older adults in the nation. We're so blessed. I haven't talked this long without a break in a while. They also have callbacks and things like that. It's absolutely amazing. If you get a chance, you should go check them out. And then there are local county mental health crisis intervention numbers. For California, the URL is up there. You can look for specific county and where your client lives and get them connected that way as well. Next. I don't know if you all have ever experienced a warm handoff. You get somebody in your office and you like that gut feeling tells you, oh, something's really wrong here. I do not feel comfortable letting them leave my office. I am afraid they're going to go and do something. A warm handoff is when you know a mental health professional that you can either invite into your office to sit with you, depending on where you work, or you can hook them up on the phone. But what you want to do is do a physical introduction to somebody that you can hand the mental health case off to. You do that for a couple reasons, because if you're feeling down, depressed, suicidal, and I come up and I'm like, oh, here's a phone number to go call somebody. What is the chance, do you think, that they're actually going to use that phone number? Yeah, it's pretty much zero. Now, if you have a caregiver in with you, she may or he may do it, but the actual person who's struggling will not. So if you get that gut feeling that, oh, there's something desperately wrong here, then what you really want to do is the warm handoff. If you just know somebody that you can call and actually hook them up, that's the best way to do it. Excuse me, final thoughts? Next screen. Coming back to the tool that I was talking about earlier. Behavioral activation should be part of a lifestyle plan. You remember when you want to not cough, that's when you got to cough. So you want to encourage things like physical activity. You want to encourage a healthy, balanced diet. Mediterranean diet is excellent. Small meals, they're balanced for your heart health. 7 to 9 hours of sleep. It is a myth that as we age, we need a lot less sleep. I think sleep needs decreased by an hour. So if you're having someone in your office who says they're sleeping 4 hours or less, you really need to encourage them to sleep. Being socially connected. right? Because that is a huge lifeline. And then, of course, the positive activities for a day. And then if they're struggling, it is helpful for them to share with somebody outside of their household. Share with family, share with friends, share with professional, but share with somebody so that somebody knows to check in, right? Okay, now I get to do my plug. So what is the Optimal Aging Center? The Optimal Aging Center is a training center for individuals that work with older adults or caregivers. We offer training to licensed health professionals in cognitive behavioral therapy, or CBT, specifically to work with treating later life depression for older adults. We also work with individuals, professionals who work with caregivers. If you're looking for a program that you can give, an evidence-based intervention that you can use with caregivers, either virtually through Zoom, or in a or one-on-one or in a small group, we have programs that we can train you in to help you. So if your agency is interested, please contact me. So on our website, we offer the COPUS. We talked about that a little bit. We also offer positive activities and caregiving scale. Both of these are free on the website. You can download them and use them at any time. I think that's it. So go ahead, next slide. There's my contact information, including my email address, our website, and then this is the Google Drive that I spoke about originally. You can download a PDF of the slide set, as well as copies of the panel and the positive activities. Whew, did I do it?
You did it. No, you did.
So does anyone have any questions about what I just went through very quickly? Go ahead.
So actually just yesterday I was talking to a client, and I know many like that. Their positive activity is watching TV 12 hours a day, or binge watching Netflix, which we all learned to do during the pandemic. And it's not clear to me that that necessarily is a good thing to spend that many hours in front of the TVs, given what they actually show you, etc. How do you help people if they say that's what I enjoy doing, lifting my mood, by watching TV 12 hours a day?
Encourage, don't discourage the TV watching,
Okay.
but encourage them to add other activities to the day. So when's the last time they got out? You know, there's a lot of really great research that just getting out into nature can lift mood. You don't necessarily have to do anything, just going out and hearing the trees and listening to birds can do a lot. So encourage them to add small little activities like that to start.
Okay, that's great.
Who else had a question?
Question or comment. That was so excellent. Thank you. And I don't know about anybody else, whether you're a senior or not, but through COVID, being home for a year, the isolation, the anxiety of going to the grocery store, wasn't there a few things through that you had felt personally yourself? Yeah. So I'm going to thank you. That was very beneficial.
Awesome. You know, even though COPUS has older persons in, y'all can feel free, if you have worked with clients that are not older adults, this is just as effective, and it's effective for yourself as well.
Yeah.
So, any other questions or thoughts?
I have the same question as Leslie. I can just hear the person say, my choice would be that you would just leave me alone for, half an hour. But, just, I want to be left alone. But your answer was helpful in that that's great. We'll do that. And we will also find something that's more active.
Well, it's, that isolation, there's two minds of the isolation, right? We are a society that is built for extroverts, right? Where the assumption is everybody needs to be socially connected 24/7 to everybody else. That is the answer. It's not the answer for everyone. Some of us need it in a little bit more moderation, right? We need that alone time. What would they like to do by themselves? All right, so you want to be by yourself. That's awesome. What activity can we schedule? Do you want to read?
Or could it be outside instead of in?
Exactly, would you like to go sit in, you know, the park for a little while? Would you like to go feed the birds? There are a lot of activities that you don't have to do with other people. Matter of fact, the initial activities we encourage people to do are those that they can do by themselves, that they don't have to depend on somebody else.
Right. So my, go ahead. My other comment is that those support lines, that increasingly our aging population is able to text and use. And the text crisis line, the 741-741, 147-147, is another one that after that list, because that's more comfortable not having to talk to somebody.
True.
That is true. One of the reasons I put the URLs of the crisis lines up is because you will find options for text available, as well as not just phone calls, but emails. It's important to note that the newer methods of communication may be limited in time, maybe only like Monday to Friday, 9 to 5, where the phones are usually 24/7. Any other questions?
So, I feel really bad. I want to cut you off because I know people need to go. And we also have we have the raffle. So if anybody has cards to put in, because I know people are kind of like, yeah, but you were fabulous. Thank you so much.
It's probably a good idea because I could probably talk about this till noon. So.
Yeah. Thank you.